Today's video is the type I find really difficult to make. It's about a tragic story that has captured the headlines in the UK, the death of Thomas Kingston, a member of the extended royal family. He seemingly had it all, an ex-diplomat with a successful career, a loving family, and a bright future. But in the blink of an eye, everything changed. Out of the blue, Mr. Kingston took his own life, yet the coroner's inquest did not classify his death as a suicide. So why not? Well, to understand this, we must delve into a topic that I've been talking about for years, the devastating and often dismissed consequences of antidepressant side effects. Side effects that unfortunately many people don't even know exist. And so this is the story of Thomas Kingston, and it's one we can't afford to forget. Firstly, a bit about Thomas's background. Prior to marrying into the royal family, he had worked for the diplomatic missions of the Foreign Office. While stationed in Iraq, he'd worked as a hostage negotiator and even survived an attack by a suicide bomber. He moved back to the UK and became a banker, and in 2019 he married Lady Gabriella Windsor, the daughter of Prince Michael of Kent. Thomas Kingston was living what most would consider a dream. At age 45, he was a successful director of a company and described by everyone who knew him as charming, intelligent, and most of all, full of life. In January 2023, Thomas began to experience problems sleeping due to stress at work, and he confided in a doctor who diagnosed him with anxiety, a mental illness that had seemingly come out of nowhere. Because up until this point, he had no history of having any mental health problems. To help him cope, the doctor prescribed zolpiclone, a sleeping pill very similar to Ambien or Sonata, and also sertraline, an SSRI, with the hopes that this would help him feel better. Unfortunately for Thomas, it did the opposite. After Thomas started taking the sertraline as prescribed, almost immediately he began experiencing troubling side effects. He reported feeling unusually low in the mornings, overheating during the day, and becoming woozy and even disoriented. Recognizing that the medication wasn't working, Thomas made the decision to stop taking it after just 4 days. And here's where the story takes a dark turn, because it seems like his doctor missed the significance of him worsening on the sertraline. The next step was one that doesn't quite make sense, because usually when someone has side effects to an antidepressant, you might try a non-drug approach, or you might try a very different medication. But that's not what happened in Thomas's case. Instead, the doctor switched him to another SSRI. That's right, a drug from the exact same class, citalopram. And this is troubling because if someone has a side effect to a medication that makes them worse, oftentimes if you put them on a medication that's in the same class, they'll experience the same side effects again. And that's exactly what happened. So Thomas only took 2 doses of citalopram before deciding to stop again, as the drug once again made him worse. And shortly after stopping the citalopram, Thomas visited his parents' home, and he spent the weekend there, enjoying meals with his family and even attending his young niece's birthday party. And by all accounts, Thomas appeared to look well. And he even sent his wife a message that all was good here. But sadly, this was going to be the last message that he ever sent to her. Because on the afternoon of February 25th, Thomas was helping his parents organize their belongings. And among the items he was organizing was his father's shotgun, which Thomas had planned to store in a secure location. However, at some point during the day, he took the shotgun into an outbuilding on the property and locked himself in the upstairs bathroom, and in a moment of impulse, took his own life. Now, whenever someone takes their life under suspicious circumstances, an inquest is conducted in the UK, or in the US, it's a coroner's report. And this is what people do to simply understand the cause of death. It's not a malpractice case or a criminal proceeding. It's simply getting to the bottom of what happened. And when the coroner looked into Thomas's death, the toxicology report showed that he had no recreational drugs or alcohol in his system at the time of death. There was only a small amount of caffeine and zolpiclone. During the coroner's inquest, a pivotal report came from Dr. David Healy, an expert in drug side effects, and he explained what had likely happened. He testified that SSRIs like sertraline and citalopram could cause severe adverse effects in some individuals, including heightened anxiety and even suicidal thought. He explained that these medications can lead to malignant anxiety, a state far worse than anything the patient had experienced before taking the drug. Now, this drug-induced worsening is something that is truly terrifying. Now, I've spoken to numerous people on this channel who have entered a state of obsessive suicidal thoughts and dark thoughts. And this has happened to some of them even after taking a few doses. It's as if the few doses of the drug has caused an insult to the nervous system that's left people in this terrifying state. And for many people, this resolves quickly, but for some, it can go on for months or even longer. Now, that's what I think may have been happening to Thomas, that after taking those medications for that short handful of times, he had developed completely out of character obsessive suicidal thoughts. In Dr. Healy's report, he also went on to criticize the lack of clear warnings about these risks in the guidelines provided to doctors and patients. Dr. Healy said that medication regulators have shied away from saying that even healthy volunteers put on these pills have gone on to commit suicide, and that we need a much more explicit statement saying that these drugs can cause people to commit suicide who wouldn't have otherwise. Now, I completely agree with Dr. Healy that regulators have done a terrible job warning doctors and the public about the risk of suicidal thoughts and behaviors. Now, if we look at the label, which I have up on the screen, this is the drug label for Zoloft. And what you can see clearly here is it says that the drug can cause suicidal thoughts and behaviors in pediatric and young adult patients. Now, Thomas Kingsley was not a pediatric or young adult patient. He was a 45-year-old man. So why does the drug label only say that it can happen in these younger populations? Well, it has to do with epidemiology research, which is in many ways a really bad way of looking at some side effects. And that's what's happened in this case here, because what they found in the clinical trials was that there were actually more suicide attempts in the younger people who got the drug rather than the younger people who didn't get the drug. I'm going to say that again because that's kind of crazy for some people to hear. If you are under age 25, you are more likely to have a suicide attempt in the double-blind randomized controlled trial if you got the drug than if you did not get the drug. And that's why they word the risk in this way where it seems like it only relates to young people. And I've spoken to a lot of doctors out there who think that this is not a risk that people need to be concerned about. It is. It's just something that happens more commonly in young people. And I don't think that's a reason why you should try and kind of specify this risk down to just young people, because then I think it gets really confusing. Because it wouldn't make any sense that when you cross age 25, this is not a risk that can happen to you. It's just less likely. And on top of that, this warning is really mealy-mouthed, and they kind of pull their punches a lot, where they say there were actually no completed suicides here, which kind of goes against what we're seeing. Just because you don't see suicides in the clinical trials, which by the way are done in a more controlled setting and only for 12 weeks of time, even if you don't see a suicide there, it doesn't mean that in the real world, actual suicides aren't going to happen. In fact, it's almost obvious that suicides will happen, because if you have a drug that is increasing the incidence of suicide attempts in the people who take them, it's very obvious that in a real world setting that's a lot more uncontrolled and people are kind of combining the drugs with other drugs at that time, that risk is going to go up. And so they kind of talk out of two sides of their mouth in this warning, trying to pull their punches. And I don't think it does favors to anyone. In fact, I think it confuses people, because the best thing that you could tell people about this warning, and the whole warning could be rewritten to simply say, in a rare number of people, these drugs cause paradoxical reactions that can make people of all ages suicidal, and yes, in some cases may lead to completed suicides. The risk appears to be more likely in young adults. You could replace that whole section with that, and it would be much clearer to everyone. So let's go back to the coroner's report now. So the inquest also heard from his wife, family, and business partner, who all testified that Thomas had shown no signs of suicidal intent. And shortly before his death, he had even booked a flight to South Africa and had spoken to his parents about visiting more regularly. Again, these are not behaviors that people typically do when they have an intentional suicide attempt coming up. Sometimes they leave notes. Sometimes they give their belongings away. They're not usually engaging in planning for future events. These are all signs that the suicide attempt was in fact impulsive and out of character for him. And in fact, his wife even went on to say that she imagined his actions were due to a sudden impulse and anxious thoughts likely triggered when he saw the shotgun while he was helping his parents organize their home. Now, here's the unusual thing about this case, because despite the coroner ruling that Thomas took his own life, he declined to classify it as a suicide, citing a lack of intent. And ultimately, the coroner concluded that Thomas's suicide was a result from an antidepressant side effect. And he said, "I'm satisfied that Tom took his own life using a shotgun. However, currently I have no evidence before me to suggest that he had formed a settled intention to take his own life. To the contrary, the evidence of his wife, family, and business partner all support his lack of suicidal intent. Intent remains unclear, as the deceased was suffering from adverse effects from medications he had been prescribed." Now, following the inquest, the coroner announced plans to issue a prevention of future deaths report. This is the strongest action available. This report will urge regulatory agencies to reconsider how they communicate the risks associated with SSRIs, particularly the dangers of switching the medications when someone has already had a severe side effect to a drug in the same class, and also the need to monitor for worsening during the early stages of treatment. Now, while this case has generated media attention, the systemic issue it highlights, the inadequate warnings about drug-induced harm, remain largely unaddressed. And here's the painful truth. Cases like Thomas Kingston are not as rare as you might think. And this is not a surprise to you if you're a regular watcher of our YouTube channel, because we've covered several drug-induced suicides or suicide attempts on this channel. In fact, a couple of years ago, we talked to a woman who threw herself off a bridge due to an antidepressant side effect. And these side effects often go unreported or even dismissed as isolated incidents, leaving grieving families in this kind of limbo where they are not validated when they're trying to make sense of this terrible thing that has happened in their life, which no one was expecting. Now, truthfully, there is a reason why a lot of these families never get the closure that they want. And David Healy described this really well in his 2023 paper, where he talked about what typically happens following a drug-induced death. Now, oftentimes, when a suspicious death occurs, there's this coroner's report, just like what happened in this case. And frequently, the doctors are called to the coroner to tell them what happened. And oftentimes, their legal counsel will urge their doctors to not say this was a drug-induced suicide. And that's because if the doctors say that, it would open themselves up to a malpractice suit, possibly. And so for the doctors, it ends up being easier for them to say, well, this was just an unexpected suicide attempt, and this person was clearly suffering from an underlying mental illness. That way, it essentially puts the blame on the person and not on the medication, and by extension, the doctor, who should have been monitoring the person for drug-induced worsening. Unfortunately, all of this results in a system that prioritizes, one, protecting the doctors who prescribe the drug, but also the medications over the patients. And while I do think it's a great thing that the coroner, in the case of Thomas Kingsley, is going to issue this report to regulators, it really remains unclear whether this will lead to any meaningful change. Another interesting thing this case highlights is the issue of monitoring someone after they are put on these drugs. Oftentimes, when a doctor will prescribe it, they'll say to the patient's spouse, if they're, just watch them closely for any signs of worsening. Well, as you can see in Thomas's case, this happened in a split moment. In fact, he was looking well when he was at his parents' house, going to birthday parties and reassuring his wife that he was doing okay. And then in that split second that he was left alone, he took his life. Now, I think everyone wants to believe that these drugs are very safe and you can monitor these risks all the time, but this case simply shows that you can't. And so even with the best monitoring, sometimes these things can happen. And that's a really unnerving thing to think about. It is simply a risk that is not 100% controllable. Another thing that this case brings to mind is simply how poorly we inform patients about these risks. There's a good chance that if you're watching this video that you may have taken an antidepressant before. Think back, what did the doctors tell you at the time? Did they even tell you that it could lead to worsening depression or even suicidal behaviors? Was it a detailed discussion about how to monitor risks? Because what I saw when I was training was that this was rarely mentioned to people in the short 15-minute appointments. They were typically told the drugs were safe and effective. And then when you go to pick up the drug at the pharmacy, instead of the pharmacist talking to you, they usually make you just like sign a little thing here without even saying anything. And you're not really aware of what you're signing, but it's essentially saying that you were given an opportunity to talk to the pharmacist about the risks. And so what I often see is that there's no real informed consent. We just kind of hand these medications out and churn through them. And I think that's an experience a lot of people have when they take these medications, and it's simply wrong. If we are going to take something from Thomas Kingston's case, it's that everyone needs to be involved. I always think that if you're taking an antidepressant, you need to be told that they can worsen mood and lead to suicidal behavior, and your loved ones need to be told that they need to keep a close eye on you. Those two things can go a long way to mitigate this serious risk. Thomas Kingston's story is a powerful reminder of the hidden risks of SSRIs. Now, if this video has resonated with you or raised questions, I strongly recommend that you watch my video with Dr. David Healy, where we dive deeper into the dangers of SSRI antidepressants and the systemic issues surrounding medication safety. Thank you for watching, and take care.